Hi, and welcome back to another day in Theme 1. Today we're going to present HIV/AIDS. My name is Cristina Rodriguez.
Andrea Martínez.
Regina Moreno.
Priscila Olvera.
En Kinam, Nevárez.
And today we're going to present a case of HIV/AIDS. We have a special guest. You're going to present her case in this kind of topic.
I presented these symptoms: fever, fatigue, rash, headache, swollen lymph nodes, sore throat. At the hospital, they asked me several questions, and one was if I had unprotected sex, to which I replied that it had been 4 weeks ago. The doctors decided to do an HIV antibody test so they can know if that was the cause of my symptoms. The HIV antibody test was positive. The doctors spoke with me about the results and told me that since I presented symptoms, they detected it before it progressed to AIDS, because in many cases there are no symptoms when they get HIV. The doctor explained that most people with HIV/AIDS only find out about their HIV status at the late stage of infection, when symptoms start showing or after the person falls extremely ill.
When a person is infected with HIV, his or her body's defense mechanisms will start to weaken. At the end stage of HIV infection, the individual is susceptible to opportunistic infections. These are infections caused by viruses, bacteria, and fungi that are usually incapable of penetrating healthy immune systems. The doctor also explained to the patient that AIDS is the end-stage HIV infections. These are some of the symptoms that may present themselves when a person develops AIDS: chronic diarrhea, weight loss, soaking night sweats, Kaposi's sarcoma, cervical cancer, lymphoma, and tuberculosis. The doctor explained that the HIV treatment that involves taking medicine that reduces the amount of HIV in your body. HIV medicine is called antiretroviral therapy. There is no effective cure for HIV, but with proper medical care, you can control HIV. Most people can get the virus under control with 6 months. Taking HIV medicine does not prevent transmission of other sexually transmitted diseases.
How HIV/AIDS are diagnosed and what is the treatment? People are diagnosed with AIDS when they have certain signs of symptoms. Blood tests are the most common way to diagnose the human immunodeficiency virus, HMV, the virus that causes acquired immunodeficiency syndrome AIDS. People exposed to the virus should get tested immediately. Early testing is crucial with HIV. If you test positive for the virus, you and your doctor can develop a treatment plan to help fight HIV and ward off complications. Early testing also can alert you to avoid high-risk behavior that could spread the virus to others, because it can take from 6 weeks to 6 months to develop antibodies to the virus. The primary tests for diagnosing HIV and AIDS include ELISA test, stands for enzyme-linked immunosorbent assay. If an ELISA test is positive, the Western blot test is usually administered to confirm diagnosis. If an ELISA test is negative, but you think you may have HIV, you should be tested again in 1 to 3 months. Home test, the only home test approved by the United States Food and Drug Administration is called the Home Access Express test, which is sold in pharmacies. Saliva test. A cotton pad is used to obtain saliva from the inside of your cheek. The pad is placed in a pile and submitted to a laboratory test. The results are available in 3 days. Positive results should be confirmed with a blood test. Viral load test. This test measures the amount of HIV in your blood. Generally, it's used to monitor treatment progress or detect early HIV infection. And Western blot. This is very sensitive blood test used to confirm a positive ELISA result.
Kind of immune response the body goes through. Well, when HB gets inside of the body, it attacks the immune system. The immune system has many kinds of white blood cells to fight diseases. HIV finds the specific white blood cells called CD4, and HIV gets inside of them and makes copies of itself. Then the HIV kills the CD4 cells, and the new HB copies find other CD4 cells to get inside of and start the cycle again, has an active reaction. The immune system tries to control HIV by making more CD4 cells, but when the immune system cannot make CD4 cells fast enough, the amount of virus in the body goes up and the number of CD4 cells goes down. When the immune system can no longer control HIV, the person becomes sick.
How to prevent contagion? Prevention and protect others if you have HIV. Prevention. You can use strategies such as abstinence, not having sex, never sharing needles, and using condoms the right way every time you have sex. You may also be able to take advantages of HIV prevention medicines such as pre-exposure prophylaxis, PrEP, and post-exposure prophylaxis, PEP. Protect others if you have HIV. HIV medicine can reduce the amount of HIV in the blood, called viral load. HIV medicine can make the viral load very low, so low that a test can detect it, called an undetectable viral load. If a person has an undetectable viral load, they have effectively no risk of transmitting HIV to an HIV negative partner through sex. Having an undetectable viral load also helps prevent transmission to others through sharing needles, syringes, or other injection equipment, and from mother to child during pregnancy, birth, and breastfeeding.
There are 3 critical barriers and how they help eliminate pathogens. Skin, vagina or anus, and mucous membrane are the 3 barriers which our body produces to help us eliminate pathogens. They work as a barrier to stop pathogens and eliminate them.
Thank you for coming to another episode on Team One. Stay tuned to our new topic about another cases of this. Thank you.